Hello and welcome to the American Academy of Pediatrics community talk on COVID-19. This is a pediatrician perspective. Who are we? We are pediatricians in San Diego. We have collaborated together to bring you this talk on our experience with COVID-19 in hopes to bring the community together and to provide some education. The pediatricians in this talk include Dr. Erin Fortune, Dr. Ricardo Indocochea, Dr. Leah Kern, Dr. Veronica Naudin, and Dr. Gwendolyn Wright. We work in all parts of the county in San Diego, and we all work in different organizations, but we have collaborated together to bring you this educational talk today. We are members of the American Academy of Pediatrics, and specifically, we are part of the school and COVID committee. We are pediatricians, we are parents, and we are children of parents 65 and older, and we are bringing this experience of COVID-19 as an educational. Now, we wanted to talk to you today about the coronavirus. As pediatricians, we are familiar with infectious diseases. The coronavirus is a type of a virus. There are many types of coronaviruses. The human coronaviruses were discovered in the 1960s. 4 types are common causes of the common colds in children, and 75% of children less than 2 years old have already experienced this type of coronavirus infection and have antibodies against this type of coronavirus. More famously, in 2002, they had the first coronavirus SARS outbreak. SARS stands for Severe Acute Respiratory Syndrome, and there were over 8,000 cases and 774 deaths during that outbreak. In addition, in 2012, they had a Middle East outbreak. They call that the MERS outbreak. There were 1,700 cases and 678 deaths. Those were the 2 most famous cases of coronavirus infections until now. In 2019, we all became familiar with what is now known as COVID-19. This is a novel type of coronavirus. It was different than the other coronaviruses that we've experienced. The coronavirus gets its name because of its appearance. When you look under the coronavirus under the electron microscope, it looks like it has a little bit of a crown, and so that's how it gets its name, coronavirus. It is now formally called SARS, which is for Severe Acute Respiratory Syndrome, COVID virus number 2, but we still will probably always know it as COVID-19, coronavirus from 2019.
So by now, many of us are familiar with some of the symptoms of COVID-19. These can appear up to 2 to 14 days after you were exposed or in contact with the virus. And different people have different symptoms. Common symptoms can include, but not everyone gets all of these, fever, chills, muscle aches, cough, sore throat, diarrhea. Some people have loss of smell or taste, and some just have very mild runny nose or congestion. Up to 40% of people may not have any symptoms at all. This is what we call asymptomatic. And this is an important group because we know they can still spread the infection. Treatment for COVID-19, again, most people have very mild symptoms that can be treated at home with things like Tylenol, ibuprofen, and drinking plenty of fluids. An important part of treatment is protecting the people around us. And 10 days from when our symptoms started, or if we're one of those people who never get symptoms, 10 days from when our test is positive, we're contagious and we need to stay away from others to not get them sick. It is important to contact your doctor if you think you have COVID-19. They can walk you through the treatment. They would know your history best and what to recommend. One reason you might want to discuss with your doctor if you think you have COVID-19 is that we're getting better at treating this disease. And there is a treatment called these monoclonal antibodies that people age 12 and older who have high-risk conditions may benefit from if it's received early. So that's a reason to talk to your doctor. Fortunately, most people do not require hospital treatment. In general, some symptoms that may make you concerned about the hospital would be difficulty breathing, significant chest pain, extreme tiredness, dehydration, and confusion. So those would certainly be symptoms that would be alarming and would recommend treatment. Again, as we've learned more about COVID-19, we're getting better at treating this. And there's some treatments listed here, whether you need oxygen, IV hydration, an antiviral medicine called remdesivir, and anti-inflammatories. Speaking of, as pediatricians, we can talk best about COVID in children. And the majority of children have very mild illness or no symptoms at all. Fortunately, very few children are hospitalized due to COVID illness. In San Diego, less than 1% of the children who've ever tested positive for COVID have needed to be in the hospital. There was unfortunately a report of one child who did pass away. Again, we don't have the details, the medical details, but we understand this was a child who had a very significant underlying condition. There are conditions that may make your child higher risk of complications. These can include obesity, significant neurologic disorders, heart disease, sickle cell, diabetes, if their immune system doesn't work, or significant chronic kidney and lung disease. Asthma is a common illness in children, a common medical condition. And so many parents are wondering, does having asthma put my child at higher risk of getting sick? And this is something we're still working on. But in general, children who have mild and well-controlled asthma do not seem to be at much higher risk. There is one important, very rare complication that we want families to know about, and this is called MIS-C. This can occur 1 to 2 months after COVID. Children may present with, again, different symptoms, but could include fever, significant chest or stomach pain, vomiting, diarrhea, some rash, and headaches. It's a condition where there's inflammation affecting multiple organs. There are good treatments in the hospital, fortunately. So when should you contact your child's doctor's office? First, if you think your child has COVID, we'd love you to call your doctor and talk about testing and treatment options. If they've been exposed to someone with COVID, it's important to check in with your doctor. And then in that very rare condition, if your child had COVID and gets sick again within 1 to 2 months, give your doctor's office a call to talk through. When would you need to take your child to the emergency room? Again, if they're having trouble breathing, persistent severe pain in the chest, signs of dehydration, acting confused or too sleepy, and in general, if there's symptoms that make you very worried about your child, we'd encourage you to talk to your doctor first. But if they're very concerned, the emergency room is always available.
The COVID pandemic has impacted us all, and it's particularly impacted children and families. Millions around the globe have been infected, and here in the United States, millions have been infected, and over 500,000 people have died. The COVID pandemic has really created a lot of challenges for children and families. There have been economic challenges, with some families affected by job losses and others by food insecurity. Social isolation has been an issue as families have had to isolate from their supports, whether that's other family members or friends. And this has led to increased household stress and mental health issues for children and families, including anxiety and depression. For children, their lives had been upended by COVID. The activities that they do in their schools have been very much impacted. For many, schools have been closed for in-person instruction since March of 2020, and children and families have had to adapt to distance learning. And many activities that children enjoy doing, whether it's sports or dance or music or art, have had to close or been limited. And most difficult of all, many families have had to deal with serious illness and death due to COVID. It's important to recognize that COVID infections and deaths have impacted communities in San Diego very differently, with higher rates of COVID infection and deaths in the south region of the county. Hispanic, Latino, Black, and Native Hawaiian, Pacific Islander families have also been disproportionately affected. We have observed some positive effects of the pandemic because of mask wearing, isolation, and social distancing. We as pediatricians have definitely seen decreases in common illnesses, decreases in the common cold, flu, asthma attacks, and ear infections. Some children and teenagers, particularly those with social anxiety, have reported that they prefer distance learning. They don't want to deal with the trauma at school. Some families have also reported that they enjoy the increased family time with each other. Children are definitely learning new skills. And most children are extraordinarily resilient. They're facing these challenges and learning new things and dealing with them in a positive manner. However, we as pediatricians in San Diego are very much concerned with the long-term impacts that long-term distance learning is having on our patients. We are seeing increased amounts of obesity, which could have long-term impacts for our patients. We're very concerned about the academic challenges with distance learning. There's been less school participation. Children and teenagers have had more failing classes, putting many teenagers at risk for not completing high school graduation. And particularly, distance learning is not developmentally appropriate for many younger children, especially in those in kindergarten, first and second grade. Many of them find it difficult to sit and focus, and they're not independent learners. So we're concerned about this long-term effect on their education. Children with disabilities, particularly those with speech impairments, learning disabilities, or motor impairments due to conditions such as cerebral palsy, get many of their therapies through the school system. With distance learning, teachers and therapists have really done a terrific job of trying to provide these therapies through distance learning. But this is not an ideal way for children to get these therapies, and we worry that they're not getting the adequate care that they need for their disabilities. We're also very concerned about the inequalities in the different modes of instruction. Most of private schools and independent schools have been providing in-person education. Some school districts are providing hybrid, which is a combination of in-person and distance learning, while the majority of children in San Diego County have had distance learning since March 2020. And it's concerning that there are these disparities of instruction for our patients. We're very also concerned about prolonged social isolation, with children being isolated from their friends, and that important part of learning through play and interacting with their fellow classmates. And we're very concerned about mental health and have seen increases in anxiety, depression, and suicidal ideation.
We are all, as pediatricians, seeing these changes in the mental health of our patients, and it is across the board, across the country. Increased calls to the hotlines and increased incidences of mood problems. So we'd like you to know the symptoms of anxiety and depression. Mainly, you're looking for changes in mood But sometimes you won't see your child as looking depressed and sad, but especially with teenagers, they might be very irritable, easily upset, um, angry. Also, they may become very withdrawn. We're going to talk about on the next page what to do if you notice these changes. They may also become less interested in activities that they used to like, no longer wanting to see friends, or no longer interested in different hobbies they may have, no longer expressing plans for the future. Some kids will begin sleeping a lot or become unable to sleep at night, and they may begin to eat more or eat less. And signs that would be especially alarming is if you notice that your child is talking about wanting to die or having no hope or even beginning to hurt themselves or use drugs and alcohol. We want to give you some information about how to support kids' mental health and your own. There are many things that you can do at home to help your whole family feel better. And really, the most important is just to get outside. We're so lucky in San Diego to have this great weather. And I encourage all my patients to get outside every day for a walk. Access to nature is very important. If you want to learn to do relaxation, mindfulness, or meditation, and then any kind of exercise is very important. And this all works to be together because if you're getting outside and getting exercise and sunshine, it will improve sleep. But it's important to get your children off the screens before bed so they can have a good night's sleep. And of course, it's very important to talk to your kids about how you're feeling, even if they haven't told you they're not feeling happy. You can ask them, are you worried about COVID? Are you missing your friends? Or I've noticed that you seem more withdrawn, or you seem sad, or you're getting angry more easily. Listen to them, ask lots of questions, and we're going to give you some resources on the next slide. So call your pediatrician. They know how to help you. There's the Smart Care Parent Line. They can help link you to resources. There's the Up to San Diego. Sorry, I went in the wrong order there. There's several helplines that we have listed here, and it may be useful for a teenager to make sure they have it in their phone, so they know what number to call if they're suddenly feeling really down. We also want you to know that there is an urgent care specifically for kids who are showing some sort of mental distress. It's listed there on University Avenue. It's open from 10:30 in the morning until 8 p.m. at night. And they can provide you with immediate assistance, and it may be better than your local emergency room. And please reach out to us.
Thank you, Dr. Wright. So for this next set of slides, I would like to discuss why a return to in-person school is the best option for our patients, how that would look, and hopefully with that information, you can decide whether that is the correct decision for your family. So I would like to begin by relaying this statement that the American Academy of Pediatrics released in early January of this year. And given its importance, I will just read it verbatim. It says why in-person school is best and when it is safe. And it reads that schools provide more than just academics to children and adolescents. In addition to reading, writing, and math, students learn social and emotional skills, get exercise, and have access to mental health and other support services. For many children and adolescents, schools are safe and stimulating places to be while parents or guardians are working. For many families, schools are where kids get healthy meals, access to the internet, and other vital services. So this next slide depicts the number of COVID-19 cases in San Diego County by illness onset date. And at the far left on the x-axis of this slide, the bottom axis is the dates of February of last year. And at the far right, we have early March of this year. And then on the y-axis, you see the number of cases by date. And so you will see that there are two peaks essentially in this slide. The first one was in the summer, where we were seeing about 500 to 1,000 cases per day. And then the second peak was the wintertime when we were seeing up to 5,000 cases per day. But the key point is that you can see the number of cases per day has decreased precipitously since the peak right around the new year. And that is why we're discussing why and how to return to in-person school. So the question then is for parents to make is it safe for my child to return to in-person school? And what we would like to convey is that with good safety measures in place, it is rare for children to get COVID from going to school. And we say this because we have studies that show, okay, that it is safe in states and communities where schools have opened. North Carolina was one of the first states to reopen their schools. And researchers from Duke University and the University of North Carolina found just 32 cases of in-school transmission among nearly 100,000 students and staff over a 9-week period. Another of the states that opened schools last fall was Wisconsin. And at 17 K through 12 schools in Wisconsin, in rural areas, they opened and implemented measures that would limit spread. So their key procedures included the use of masks, establishing groups of 11 to 20 students. Staff maintained 6 feet of distance if possible, and they quarantined in suspicious cases after exposures. And the teachers reported that more than 92% of students in their classes were using masks. So what did they observe over a period of approximately 3 months? That only 7 of 4,876 students and 0 of 654 staff members were known to have gotten COVID-19 at school. Now, I will add, though not included on this slide, there are studies and there are reports of outbreaks and clusters at some other schools of cases of COVID-19. But the key point to note from those other studies is that all of those clusters of outbreaks can be tied to a failure to follow proper COVID-19 safety protocols, which we'll get into on the next slide. So the key point to draw from this slide, we'll go through the layers of protection, what we recommend when kids return to school, but there is not one magic bullet that will control spread of COVID-19. All of these measures will help mitigate the spread to different degrees and in different manners. And it is the combination of these measures that can effectively control spread. It is truly the whole of all these measures that is greater than the sum of its parts. So what are these layers of protection? Number one, first and foremost, is masks. Number two is physical distancing between students. Now you will note there is a range here of 3 to 6 feet apart. And though I don't have time to get into the details behind that range during this brief presentation, suffice it to say that the reductions that are coming in the physical distance recommendations between students are based on data and guided by science. Number three, cohorting of students, which in essence is less mixing of them. Cleaning and disinfecting of high touch surfaces, such as desks, etc. Good ventilation within schools. Symptom screening, which can be done at home by parents before they send the child to school for the day, and at school as children are arriving. And lastly, contact tracing and quarantine. So with that information on how kids could return to school, the question then becomes for families, is this the correct decision for them? So there are a variety of things that families need to consider, and they would be the following. How has distance learning been for your child and your family? I urge you to consider what we discussed in the earlier parts of this presentation. How has COVID affected your family and your community? How will your family be impacted if your child is exposed or has to quarantine? Who else lives in your home? And lastly, are vulnerable family members vaccinated and protected from severe COVID? And again, we stress that it is families know their situation best, and they should be able to choose between in-person and distance learning.
So speaking of vaccinations, I wanted to give you a brief overview of these incredible vaccines we have against COVID. Vaccines teach your body how to protect itself from COVID. And it's important to know that none of these vaccines can cause COVID itself. All three vaccines that we're going to talk about are incredibly good at protecting us from what's most important, severe disease. In fact, recent review has concluded, based on all the clinical trials, that from any of these vaccines, we are 97 to 100% protected against hospitalization or death from COVID. That's incredible. Pfizer and Moderna are what are known as mRNA vaccines. This M stands for messenger RNA. And what it does is it goes into our body, it tells our cells to make the spike protein. That's what's on the surface of the coronavirus. This messenger RNA quickly is used and is destroyed. It does not stay in our body. These spike proteins trigger the immune system to form defenses, and those defenses are in the forms of antibodies and T cells that would help us fight off COVID. The Johnson & Johnson vaccine uses a slightly different method to train our bodies to make these defenses against the spike protein as well. The nice thing about Johnson & Johnson vaccine is it's only one dose. And again, while there's been some discussion in the media about 60%, 85% effective, what's most important about these vaccines is, again, 100% effective based on the clinical trials in the US in preventing hospitalization and death. These vaccines, while it feels like they were developed quickly, as Dr. Naudin said, coronaviruses are not new to the scientific community. And ever since those outbreaks in 2002, doctors have started thinking about, if this comes back, how are we going to be protected? And we've built on that science over decades and decades. All these vaccines went through the usual phases of clinical trials to check for safety. When we work together as a globe, look what can happen, how quickly we can do this. These vaccines are being watched very carefully. And in the beginning, some people were concerned that how many people had actually received the vaccine. This slide on the right shows you that we're up to over hundreds of millions of people have received these vaccines. Doctors were studying it closely, and we're seeing, yes, there are mild side effects, pain at the injection site, sometimes fatigue, etc. But overall, these are incredibly effective vaccines with mild side effects that doctors believe are strongly worth it to protect people and to get us back to pre-pandemic life. Specifically talking about children, the only vaccine that's approved for any children is the Pfizer, which is approved for 16 and older. Moderna and Johnson & Johnson are only approved for 18 and older as of now. But as you've all heard in the news, clinical trials in younger people is ongoing, and we expect to have some data soon. So projections, again, while we're not experts in this specific area, what we're hearing is by fall of 2021, teens may be eligible. We may have vaccinations available for them. And for younger people, it may be as early 2022. So we strongly encourage everyone, as soon as you are eligible, to go and get the vaccine. We all have, and our parents have as well. Going back to resources for families, as we said, this pandemic has had more than just medical effects. We wanted to remind families about the availability of a lot of support programs, and most of these can be accessed through 211. Right now, there's emergency rental and utility assistance applications open. These are open through March 31st. And again, you can get information on 211 or the San Diego County.gov. A lot of different feeding programs as well. Food banks are available. Feel free to discuss with your doctor or to look at 211 or county websites. And finally, for families who are looking for more information on COVID, from a trusted source. There's been so many information from different places that families may be concerned about. Where can I get trusted information? The American Academy of Pediatrics runs a website called healthychildren.org that you see here. A lot of articles and information on COVID-19 and all other aspects of children's health. So we feel this is a trusted website where you can get good, accurate information. We also strongly encourage you to talk to your child's doctor. And finally, thank you for listening. If you have a group that may be interested in an interactive Zoom talk to be able to ask us questions directly, we are going to try to have pediatricians available for these Zoom talks. And you would email us at info@aapca3.org. So thank you very much for listening, and we hope all of you stay safe and healthy.